the people ordered to go into home quarantine, basically they are so-called low risk, tier 2, all right, tier 2. That's why they are not close contacts of confirmed cases. They do not display any symptoms at all, and also is under close surveillance and also close contact with the Department of Health and so on. So they are under regular surveillance all the time. All we have talked about is really for them to spend 14 days on their own, all right, in isolation, as it were, and with full support rendered to them and their families as well. So we are talking about a special categories of so-called people under quarantine. Now, as far as venues are concerned, so-called the centers are concerned, if we're talking about home quarantine, the problem is solved. Basically, we're talking about home, all right? They've got their own places to live, to operate. For those without accommodation, we've got to provide them with accommodation. The challenge, therefore, is to find enough and suitable venues. That's why we're now doing our best, searching the right sites. That's why we call on the community, whole entire community. Citizens of Hong Kong exercise or civic responsibility, time for solidarity, time for understanding, a time for particularly social cohesion, as I always stress the word social cohesion, with time for us to stand together to face the crisis. All right? So, anything you want to supplement?
Perhaps I can invite the Director of Health to talk a little bit about the conditions of places whereby we think it is suitable or not suitable for quarantine. As I think earlier, we talk about the different risks. For example, the quarantine camps that we have now placed the close contact of confirmed cases in, I think those are of the highest risk because they are close contact of the confirmed cases. We've also put on quarantine a category of people who came from Hubei. So these people are put on home quarantine. And now we are talking about people who are coming from any parts of China in the last 14 days. So the risk level is different based on the assessment by the Department of Health. So,
well, under the existing legislation, there are two types of order, namely the isolation order, and the second one is the quarantine order. So isolation applies to patients, infected persons. So if there's a case who is highly suspected to be infected by this novel coronavirus, and also for confirmed case, they will be managed in the hospital under isolation. And once confirmed, they will be held there and kept there until they fully recovered. So that's for isolation. As for quarantine, there are several types of situation when quarantine order will be issued. In the past, we will consider the close contact of confirmed cases. By close contact, I mean, for example, household family. For example, if traveling on an aeroplane, the passengers sitting within a radius of 2 seats of the confirmed cases. So these close contact, so defined, will be put in quarantine centers. The familiar ones, which you will know, will be like Lady Macaulhall's holiday camp. So those are the close contacts of confirmed cases. So with the passing of the new emergency regulations, which takes effect tonight, it applies to anyone who has ever been to mainland China in the past 14 days. So they do not fulfill the criteria of, say, having been a close contact of a confirmed case. So they are simply anyone who has ever been to the mainland China in the last 14 days. But because of the fact that we want to achieve two purposes, namely, reduce cross-boundary movement of people, and secondly, to ask those who have been to the mainland to stay at home. In the past, we advise people to stay at home for 14 days if they have ever been to mainland China. But we think because with the recent appearance of more local cases, we think it is important and essential for these people to be applied a more stringent measures. By that, instead of just advising them to stay at home, we mandate them to stay at home. So these people are relatively low risk. That is why we adopt a different level of quarantine, having done the risk assessment.